Hi, this is Wendy Briggs with Hygiene Diamonds. A few days ago I shot a film about what I picture the ideal practice doing when it comes to periodontal services. Let me share with you a personal experience as to how I actually came to this place in my career, my personal practice as a hygienist. You know, a few years ago I struggled with a lot of the things that probably most hygienists struggle with. It was a little bit challenging to talk about periodontal services with my patients. I never felt like I had enough time to get into it. I felt like they didn't accept it. And I felt like I was trying to be the good guy and not have to tell them about this additional expense that they were going to need to take care of if they wanted to return to ideal health in their mouth. And I realized, after delving into some of the research about the systemic links and some of the health risks that are associated with untreated periodontal disease, that I wasn't doing my patients any favors. And I had to make a decision that supervised neglect was not about, it really didn't represent who I was and who I wanted to be as a hygienist in my practice. And so I made a commitment to treat every single patient as if they were a member of my own family. And it used to be that I would look and see if they had insurance, especially on borderline patients. And if they didn't have insurance, we'd try and just get by. And I realized that I was basically offering substandard care to my patients, and I wasn't happy with that. So I made an emotional commitment to turn things around, and we really have. And I don't think, you know, the sad thing is, I think anybody can do that. And the beautiful thing about maximizing the potential from periodontal services is that it really doesn't require a whole lot of doctor time. Your hygiene team can be productive by offering these services. You're treating your patients at a higher standard of care, and I think that's a beautiful thing. You know, in the past few years in working with hygienists all over the country, there's, you know, probably about 12 dangerous behaviors or challenges that most hygienists that most dentists have to deal with when dealing with their hygiene department. And I'll share with you a few of these. Let me give you a couple of them. I think probably the biggest thing is, you know, when we have set up an environment where we're actually encouraging laziness on the part of our hygienists. Now, don't get me wrong, I love hygienists. Obviously, I'm an advocate for hygienists, and I work with a lot of them, and they're great. But hourly pay breeds laziness. And so one of the dangers that we have is we have a whole hygiene team that has the potential to be highly productive, that actually celebrate a little bit when there's a cancellation. And so they're really not involved in being owners of their own productivity. And that, I think, is why we have so frighteningly low national average numbers when it comes to hygiene production. There's a couple other things that we have to deal with dangerous behaviors with hygienists, and I think, you know, again, the whole time issue. There's never enough time for them to do everything that we want them to do in the practice, and so our patients ultimately end up not being served as effectively as they could be. And so I think not utilizing our time effectively is another one of those behaviors that we really wish we could change. You know, and there's so many more that I could go on and share with you, but in the interest of time today, what I want to tell you is that tomorrow I'm going to be talking about solutions, real solutions that any dentist anywhere, small or large practice, can take and implement to help them see more of an increase in their periodontal services.